This video is titled Utilizing the Work Pane within the Health Management module in Intergy EHR. In this video, we're going to review and outline the do's and don'ts of utilizing the work pane in the health module. We're also going to review a few frequently asked questions. It is important to know that the majority of the reminders are set up with an auto-satisfying event. However, there will be specific cases in which the work pane will need to be manually updated. To access the work pane, click on the work pane checkbox in the health window. Be reminded that the information manually entered in this section is non-reportable and not captured in Intergy Practice Analytics dashboards. A frequently asked question is, why doesn't the FOBT and sigmoidoscopy satisfy when the colonoscopy is entered? There are multiple procedures that satisfy a colorectal cancer screening, and each method has a different frequency from when the patient will be due for the next screening. Follow these steps to properly document these tests. First, you will need to document the date the colonoscopy was completed. To do so, click on the Screenings tab within the Quality Measures form, and in the field labeled Date of Last Colonoscopy, click on the date box and enter the date. This step will satisfy the reminder and the report. Secondly, you will now need to modify the FOBT and sigmoidoscopy reminder to reflect a similar date. To complete, select the test and click on the previously satisfied radio button and enter the same date as when the colonoscopy was completed. In the Notes section, add a note that states that a colonoscopy was completed, and lastly, select the radio button labeled Remind Again On and enter the same recommended date shown next to the colonoscopy test. Upon completion of these steps, all three reminders will be satisfied in the health window and will not reappear until the next recommended date. Another frequently asked question is, what if a patient's results came back abnormal and there is a need for the reminder to populate sooner than the set frequency? Once the reminder is auto-satisfied, you can use the work pane to manipulate the frequency and set the reminder for the patient to an earlier date. In this example, the patient's PAP was auto-satisfied with their PAP lab result. First, begin by opening the work pane and select the previously satisfied radio button. Here you would enter the same date the reminder indicates. Next, due to an abnormal result, you will want to check the box labeled Result is Abnormal. Lastly, input the date which you would like the patient to return for this test under the Remind Again On field. This will override the preset frequency for their next suggested reminder. In conclusion, an additional frequently asked question is, can I mark contraindicated or refused in the work pane? Yes, the HCN Quality Measures form includes findings that excludes the patient from reporting when applicable. First, you will need to document the exclusions in the encounter note. From within the Quality Measures form, click on the applicable screening exclusion date field and enter the date for this patient. However, if it is a temporary condition such as pregnancy or contraindicated, then you can additionally utilize the work pane so that you can modify the frequency. To complete the step for the temporary conditions, select an appropriate option in the Mark as Satisfied Reason area and enter notes to indicate the reason why. Lastly, select the radio button labeled Remind Again On, and next to it enter the future reminder date. Thank you for viewing. and ensure to look out for the following videos on health reminders.